Welcome to the Eye Experts. I'm Dr. Eli Sluch, and today I'll be showing my technique for removing a pterygium with mitomycin seen in amniotic membrane. So first I'm going to start off by marking the pterygium, and then I'm going to cut it down on each side and make a little tunnel underneath it to cut the pterygium. Now that I've made my little pocket, I'm going to extend it posteriorly and administer my subtenon's block. If I'm going to do an autograft, I will also inject some superiorly, but we're just doing an amniograft in this case. So now I'm going to start pushing the pterygium back. I like to do it radially from the center to the periphery, just to kind of not disrupt the cornea, in case there's a LASIK flap or anything else that I didn't know about. I feel like it's a little bit more gentle in the eye. So I'm going to scrape some epithelium off, see if there's any Solzman nodules, anything like that. I'm going to try to harvest the pterygium as much as I can, and I'm just going to cut that little piece off and send it to pathology. I'm just going to clean the area up a little bit. There's still a little tuft of a pterygium, so I'm going to take my blade and again trim it a little bit more, kind of as neatly as possible. Now I have the bed. I'm going to use my burr. So I'm going to use my diamond burr, and I'm going to shave off any of the kind of raised corneal areas to again kind of make everything nice and smooth. You don't want to burr too much because you can in fact burr through the eye. So again, we're just kind of polishing here just to make sure everything is nice and clean. Once we have everything polished, we're going to remove any residual blood, and now I'm going to use some cautery. I'm just going to cauterize any of the residual blood vessels. Now, again, I don't want to cauterize too much because this needs to be healthy tissue that's going to grow over it, so I don't want to kill off the blood supply, but I do need the surface to be nice and dry. So this is in a wet eraser tip cautery. I'm just going to burn anything that's kind of actively leaking, but you can see I'm leaving the actual blood vessels in place. Now that we're done, we're going to take away any of the extra tenons tissue. And this tenons will cause pterygium retraction, so you don't want to kind of cut it back as much as you can. And they're not very beefy, it's okay to leave, but I do like to at least get a little bit off on the wings of each side. So see, I kind of pull them back, making sure I have any muscle, and just kind of trim. Sometimes they also do bleed a little bit, so you don't want to be too excited about cutting them off. Once the pterygiums are removed, I'm going to apply the mitomycin. So I usually use 0.4 mitomycin. I apply it for about a minute. You can do a little bit more, a little bit less. I think a minute is about a good number. So I use these big mitomycin sponges. I'm going to put one on each side, and again I want to cover really that tenons, that conge area on each side, because I'm not worried about cancer. I just don't want any fibrobascular tissue to grow back. So I'll leave it here for about a minute. After the minute has passed, I'm going to remove the sponges. I'm going to really irrigate that area. I don't want to leave any mitomycin in place because I don't want to get any scleral necrosis later. So I use about 3 bottles of BSS to really irrigate that area. Now that everything is dry, I'm going to harvest my amniotic tissue and place it over that bare sclera. So I use my calipers to kind of measure how much I need, and I'm going to start cutting it. The amniotic tissue has an orientation. I'm not sure how important it really is, but I do try to preserve it whenever I can, just because it may heal a little bit better, because it's its more natural form. So I'm going to use non-tooth forceps to grab the tissue on one side, and then I'm going to peel it off onto the cornea again, with the idea of preserving natural orientation that comes on the paper. Now that I have my graft, I lay it in front of the pterygium in the correct orientation, and I'm going to use seal glue. So first I'm going to put a tiny drop of thrombin, which is much thicker, followed by a very small drop of fibrin. There it goes. And now I have 30 seconds to really get the graft oriented. So I'm going to get my graft spread out, and I try to tuck it under the conge. It won't stick very well to the conge anyway,